Hi, I'm Dr. Vishal Gupta and I'm a consultant pulmonologist at the Chest Care Clinic Kharghar at Navi Mumbai. Today's video is about a very common sleep disorder which we call as insomnia. Insomnia is, in very simple words, a difficulty in falling or in staying asleep. It is estimated that up to 10 to 30% of people in the world are having insomnia at one time or the other in their life. The symptoms of insomnia is basically difficulty in falling asleep, difficulty in waking up in the morning or having to wake up very early in the morning. They may be waking up multiple times at night. This will lead to daytime fatigue, along with that mood disturbances like irritability, anxiety, and difficulty in concentrating on their work and sleepiness in the daytime. They have memory problems and they may at times be resorting to medications or to consumption of certain medicines or drugs or habits like smoking and alcohol. The insomnia can be for a short time, that is short-term insomnia or acute insomnia, or it could be lasting for very long, which is called as chronic insomnia. The main causes of insomnia are because of the stress in the day-to-day activities, anxiety, an irregular sleep schedule or poor sleep environment, the presence of caffeine or nicotine or electronic screens or a heavy meal just before the bedtime, having medical conditions like pain or because of sleep apnea or because of a restless leg issue or other medications which are making it difficult for them to fall asleep. Mental health conditions like depression, anxiety, and mood disorders, which are causing a change in the chemical brain balances, which will lead to insomnia. So, mostly it's a combination of lifestyle problems, behavioral issues, and sometimes some medications and habits which are leading to insomnia, and these can be altered, and if properly solved, can be completely resolved. So, what are the common approaches to the treatment of insomnia? Number one is to have a lifestyle change where we can adapt to a consistent sleep schedule. That means you go to sleep at one time and get up exactly at the same time every day. Creating a relaxing sleep environment, so you should make your bedroom dark, quiet, and cool. Avoid the stimulating activities just before bedtime, which includes LCD screens, mobiles, televisions, exercise just before sleep, stimulating conversations, maybe anger issues, maybe loud music, even avoiding caffeine, nicotine, and very heavy meals, alcohol also, just before bedtime. These will lead to less sleep disruptions, therefore, normal quality of sleep can be ensured. Get a regular exercise, but it is early in the morning because light exposure is very important, preferably in the outdoors. Behavioral therapies like number one, cognitive behavioral therapy, which is what we call CBTI, is an individualized approach to help the person's sleep habits and sleep thoughts get resolution. And so if it is delivered to a patient tailor-made and he sticks to it very sincerely, a majority of the insomnia problems can be completely solved. Stimulus control therapy is a technique in which the association between the person and the bed and the bedtime is established, and this association can establish a sleep schedule which will lead to a good habit, and the person doesn't have to fear sleep or be insomniac anymore. A sleep restriction therapy is sometimes used as a technique to limit the amount of sleep time in bed, but this is under medical supervision, should not be done without supervision at all, and it is trying to improve the sleep efficiency. Some of the patients will need medications like clonazepam or lorazepam and similar drugs which are called benzodiazepine drugs, zolpidem and other drugs which are non-benzodiazepine drugs, melatonin and melatonin receptor agonists, which are basically to improve the melatonin levels in the brain, antidepressants like nortriptyline and amitriptyline, which will be helpful as therapies to counter the serotonin imbalance. There are certain alternative therapies out of allopathy which are very very helpful. These include acupuncture, along with that stress reduction or relaxation exercises like meditation or vipassana, certain methods like yoga which help in body stretching and that can bring down the stress levels and improve the quality of sleep. There are certain agents in allopathy, out of allopathy, which is Ayurveda and homeopathy, which can probably help a little bit with the anxiety, which can improve the quality of sleep. So if you know someone or you are someone who has been having persistent sleep disruption causing a day-to-day activity problem or difficulties in your relationships or causing you to go towards habits like regular alcohol consumption, regular cigarette smoking in the mornings, or regular tobacco use because of a sleep disturbance, you should either speak to a sleep specialist or to a psychiatrist. If you are experiencing breathing problems or fatigue issues and there is a possibility of driving related accidents and you need to be evaluated for sleep apnea or restless leg, you should speak to a sleep disorder specialist or a pulmonologist. If you would like to connect with us, don't forget to watch the link given below in the description box and you can connect with us. Or you can drop us a message on YouTube or on Instagram accounts. The link is also given below. I will thank you today for your patient time and listening, and I hope to see you in the next video. Till then, have a nice day.